Technical aspects of endoscopic ultrasound EUS-guided sampling in gastroenterology. European Society of Gastrointestinal Endoscopy, ESGE Technical Guideline, March 2017. Recommendations. For routine EUS-guided sampling of solid masses and lymph nodes, LNs, ESGE recommends 25-gauge or 22-gauge needles. High-quality evidence, strong recommendation. Fine needle aspiration, FNA, and fine needle biopsy, FNB needles are equally recommended. High-quality evidence, strong recommendation. When the primary aim of sampling is to obtain a core tissue specimen, ESGE suggests using 19-gauge FNA or FNB needles or 22-gauge FNB needles. Low-quality evidence, weak recommendation. ESGE recommends using 10 milliliter syringe suction for EUS-guided sampling of solid masses and LNs with 25-gauge or 22-gauge FNA needles. High-quality evidence, strong recommendation. And other types of needles, low-quality evidence, weak recommendation. ESGE suggests neutralizing residual negative pressure in the needle before withdrawing the needle from the target lesion. Moderate quality evidence, weak recommendation. ESGE does not recommend for or against using the needle stylet for EUS-guided sampling of solid masses and LNs with FNA needles. High-quality evidence, strong recommendation, and suggests using the needle stylet for EUS-guided sampling with FNB needles. Low-quality evidence, weak recommendation. ESGE suggests fanning the needle throughout the lesion when sampling solid masses and LNs. Moderate quality evidence, weak recommendation. ESGE equally recommends EUS-guided sampling with or without on-site cytologic evaluation. Moderate quality evidence, strong recommendation. When on-site cytologic evaluation is unavailable, ESGE suggests performance of 3 to 4 needle passes with an FNA needle or 2 to 3 passes with an FNB needle. Low-quality evidence, weak recommendation. For diagnostic sampling of pancreatic cystic lesions without a solid component, ESGE suggests emptying the cyst with a single pass of a 22-gauge or 19-gauge needle. Low-quality evidence, weak recommendation. For pancreatic cystic lesions with a solid component, ESGE suggests sampling of the solid component using the same technique as in the case of other solid lesions. Low-quality evidence, weak recommendation. ESGE does not recommend antibiotic prophylaxis for EUS-guided sampling of solid masses or LNs. Low-quality evidence, strong recommendation, and suggests antibiotic prophylaxis with fluoroquinolones or beta-lactam antibiotics for EUS-guided sampling of cystic lesions. Low-quality evidence, weak recommendation. ESGE suggests that evaluation of tissue obtained by EUS-guided sampling should include histologic preparations, e.g. cell blocks and/or formalin-fixed and paraffin-embedded tissue fragments, and should not be limited to smear cytology. Low-quality evidence, weak recommendation. Guideline focus. This guideline from the European Society of Gastrointestinal Endoscopy, ESGE, focuses on technical aspects of endoscopic ultrasonography, EUS-guided sampling in gastroenterology, the choice of needle, sampling technique, and specimen handling and processing, and updates the previous guideline on these topics, published in 2012. The target audience for this guideline is endoscopists who perform EUS-guided sampling. Indications, results, and clinical impact of EUS-guided sampling are addressed in a separate clinical guideline from ESGE.